What's going on, guys? It's Matt. I wanted to do a video here today talking about the differences between selling and servicing in a medical device role, because a lot of times people get in and they don't really know the differences between jobs that are more service-based and jobs that are more selling-based. And they do kind of have their own characteristics. It does depend on the product, the territory that you've been given, and among other factors. So I wanted to get into them. It's your first time here. My name is Matt. I've been a medical device rep for a little bit over 2.5 years, and then I've been in a management position in a little bit over 6 months now. So it has been relatively new for me to be in this management position, but I do think I have some knowledge on the industry that I would love to share with you. So if you can resonate with that, go ahead and hit the subscribe button down below and turn on the post notifications so you get more coming from me once I do upload things. So without further ado, we're going to get right into it. So you've got your first medical device role. You're getting into it now. Let's say you are a role with Medtronic implants. So that's going to be, doing spine procedures, interbody cages, those type of things in a hospital operating room setting. You're going into a relatively large book of business, which means that the territory uses a lot of Medtronic stuff. If you're in this kind of role, you're not going to be doing a bunch of selling. Because the territory is already busy enough and they just need someone to cover the territory. So the reason that I bring this up is because if you love selling, much like I do, maybe these kinds of roles won't be for you, because it's going to be a lot more service-based than rather trying to actually sell a product, get in, book appointments with operating room staff, with surgeons, with hospital staff. It's going to be a lot less of that. So that's something to know off the top of the bat. And things for you to ask the hiring manager when you get through interviews is to ask them, what a day-to-day will look like for me. Is there a lot of selling involved? What's the territory like? What do they do in business each year? So the next one is, it also depends on the business. Because if you're doing a role that's, let's say, bracing, for example, versus joint replacement rep, you're going to have a lot more time on your hands with bracing. Not to say that, bracing doesn't take a lot of time, but it definitely doesn't take more time than procedures to fit one bracing patient. So if you see that role is something that you're applying for, just know that it will more likely be a sales role, because you have to have an increase in volume in order for you to get more business, because braces probably don't, bill out as high as surgical equipment might. So just know that off the top of the bat, when you're going through these interviews, try and fit something that fits to your personality. And some people do really enjoy service roles more. Like, they love being the guy in the OR that knows all about the the equipment, and they can get a surgeon from A to Z if they have to. Some guys love that. So just realize that with yourself and realize which one you would rather be in. So one other thing in this, the sales versus support roles, is that it also depends on how much support you have. If you're coming into a territory and you don't have any other rep, or like an associate rep, or they just had a lot of reps leave, you're going to be doing a lot of servicing in that area and not a lot of selling, because they need someone to come in and service the area. So know what you're getting into before you get into it, and then that will give you, more kind of like keys to the castle of what you're going to be doing once you get into that role. And the last thing that I wanted to say here is that it also depends on the seniority of the territory. You could have a territory that is has one rep, like I call them super reps, that have a lot of business, and they just filter through associates because the associates will come in, learn the role, but then they want to make more money, and then they jump to another company. If you have one of these in your territory, I would say be careful, because these super reps are not going to give up their business, and you're going to be servicing a lot of their cases. Which could be a good thing for you. If it's your first job out of college or something like that, then it's probably in your best interest to join something like this, so that you would be able to learn very quickly, because you'll be covering a lot of cases, and then you can do whatever your heart desires after that. But if you're more of a veteran rep that's coming in and you want to actually sell things, and product, and you want to have your own territory, then that situation would not be for you. So do your due diligence when going through the hiring process. All of these things happen. Just this is kind of like a no BS version of what goes on out there. So if you have any questions, feel free to DM me, hit me up over LinkedIn, all the above. Take care.